I'm Dr. Saucier, a cardiologist dedicated to helping you master the art of cardiology. Today, we're going to dive into one of the most essential skills for any physician, conducting a thorough cardiac physical exam. Whether you're a resident just starting out, a medical student, a seasoned clinician looking for a refresher, this video will provide valuable insights and tips. So let's get started. First, let's talk about cardiac auscultation, the cornerstone of the physical exam in cardiology. We use our stethoscopes every day, people. The key areas you need to focus are the aortic, pulmonic, tricuspid, and mitral areas. Remember, each of these areas corresponds to a specific part of the heart and can give you clues about different types of heart disease. It's also widely tested on every single exam from your steps all the way through your board exam. The aortic area is located at the second intercostal space at the right sternal border. This is where you're most likely to hear aortic valve issues like aortic stenosis or aortic regurgitation. Next is the pulmonic area, which is at the second intercostal space at the left sternal border. You'll listen here for any signs of pulmonic valve problems, such as pulmonic stenosis. The tricuspid area is found at the fourth or fifth intercostal space at the left lower sternal border. Listen carefully for tricuspid valve murmurs, which could indicate tricuspid regurgitation or stenosis. And finally, the mitral area is usually located at the apex, which is in the fifth intercostal space at the mid-clavicular line. This is when you listen for mitral valve issues like mitral regurgitation or mitral stenosis. Make sure you use both the diaphragm and the bell of your stethoscope. The diaphragm is best for high-pitched sounds like the murmurs of aortic regurgitation, while the bell is better for those low-pitched sounds, such as the murmur of mitral stenosis. Now let's talk about identifying different types of heart murmurs. Again, this is tested from the time you start all the way through your recertifications. Murmurs are sounds produced by turbulent blood flow within the heart or its vessels. They can be caused by various conditions, such as valvular stenosis, regurgitation, or congenital defects. There are two main types of murmurs, systolic and diastolic. Systolic murmurs occur between the first heart sound, or S1, and the second heart sound, or S2, while diastolic murmurs occur between S2 and the next S1. For example, a systolic murmur heard best at the aortic area could indicate aortic stenosis, especially if it's a crescendo, decrescendo, or diamond-shaped murmur. On the other hand, a diastolic murmur, best heard at the mitral area, may suggest mitral stenosis, often described as a rumbling sound. It's also essential to note the timing, location, radiation, pitch, and quality of the murmurs to narrow down the possible causes. Here, I want you guys to use something that I used all the way in my training, or I always say Mr. Sass, S-A-S, or Ms. Dar, M-S-D-A-R. And so what that helps you remember is the type of murmurs and whether they're systolic or diastolic. So for example, mitral regurgitation, Mr. M-R, S-A-S, it's a systolic murmur. Systolic murmur, S-A-S, aortic stenosis. And then on the flip side, you have Ms. Dar. MS, or mitral stenosis, is a diastolic murmur, D. And then you have DAR, diastolic aortic regurgitation. So Mr. Sass, Ms. Dar is a technique that I used to help me remember when I was training which murmurs were systolic and which were diastolic. It's also important that if you're trying to figure out how to feel for murmurs and you can't tell what S1 is and what S2 is, or what's your first heart sound, what's your second heart sound, feel your patient's pulse, okay? And so you can feel the heartbeat. That will allow you to better determine if something is systolic or diastolic when you're learning. And as you get better at your physical exam, you might not need to, feel the pulse all the time. But if you're ever curious, and sometimes patients have more than one murmur. So again, feeling a pulse, a radial pulse while you're listening can help you differentiate what type of murmurs you're listening to as well. So a couple tips to go along. Next, let's assess the jugular venous pressure, or JVP, which is an important component of the cardiac exam. Elevated JVP indicates fluid overload. Position your patient at 30 to 45 degree angle and ask them to turn their head slightly to the left. Look for the internal jugular vein pulsations between your two heads of the sternocleidomastoid muscle. Measure the vertical distance between the highest point of visible pulsation and the sternal angle. You won't always have a ruler with you at the bedside. So what I used to do is measure your fingers, and then you have known measurements when you are with your patients wherever you may be. So get out a ruler, measure your fingers, and then you can assess some JVPs. A JVP greater than 3 to 4 centimeters above the sternal angle is considered elevated. Let's also talk about hepatojugular reflex. This is the most sensitive finding in heart failure or volume overload and should also be assessed anytime you're measuring a JVD. Make sure you press firmly on the liver for 10 seconds to measure the hepatojugular reflex. Finally, let's discuss palpation techniques. Palpation of the chest wall can reveal important information about cardiac function. The apical impulse is usually palpable in the fifth intercostal space at the midclavicular line, and a displaced or diffuse apical impulse could indicate left ventricular hypertrophy or enlargement of the ventricle. Place your hand flat against the chest wall to feel for any heaves, which are sustained lifts of the chest wall, or thrills, which are palpable vibrations. These are often caused by turbulent blood flow, and palpating for thrills and heaves can help you identify severe valvular disease or other structural abnormalities. Just because you don't feel these thrills or heaves doesn't mean that there isn't a disease process underlying. But again, these are techniques to help you point you in the right direction and see what else other imaging or techniques of diagnosis that you may need. Well, that wraps up our guide to mastering the cardiac physical exam, or the basics of it. Remember, practice makes perfect, so use these techniques regularly to refine your skills. If you found this video helpful, please give us a thumbs up, subscribe to our channel for more cardiology tips, and leave a comment if you have any questions or topics you'd like us to talk more about. Thanks for watching, and I'll see you in the next video.